Hey everyone! Sorry for coming on a couple seconds late, but my name is Effie, and if you're new to watching, this is my first time coming on ZubiaLive, and I blog over at RisingAboveRA.com. And you guys can find me on my social media channels by the same name, RisingAboveRA.com. I also have a YouTube channel called RA and Myself, so you guys can check me out there where I discuss similar topics to what I'm going to talk about today. So I have, I've been living with rheumatoid arthritis for almost 15 years now, and I had a total knee replacement 2 years ago. So I wanted to give some tips on how to cope and thrive before and after surgery, because a lot of times people, they are not really guided in a sense of what to do after surgery. A lot of times there are good tips when it comes to what to do before surgery, through your hospital and the programs are involved. So I just want to give like a few tips of like what to do. And this doesn't have to necessarily apply to total knee replacements. It's more general. So if you have any type of surgery in regards to joint replacements, this will benefit you. But, my first tip here that I wanted to discuss, hold on, I just want to make sure I have that. Like I said, utilize your pre-surgery resources. So when you have surgery, they tell you to go, it's mandatory. Some hospitals say that you have to go to the 1 or 2 hour class. And obviously, it's optional sometimes if you can't make it, but it would benefit you because when I went, the nurse answered everyone's questions and worries and fears. So utilize that because it will help you understand and also help your friends and your family understand. So you can bring people to that class so they'll be able to better assist you when it comes time to, recover from surgery. And also if you're not, if you're needing more support, the Arthritis Foundation has support groups like the Arthritis Introspective, and it's a support group that meets once a month. So you can always um, as you recover and you're like, 5, 6 months out or even a year out, if you feel like you still need support with surgery or with your condition in general, you can meet up with the group and they have different topics each month. And you can meet like minded people, others who've gone through the same thing and, share your journey with each other. The other thing is read message boards online. And, you have to be careful also of where you go and read your information because not everyone is credible and you might not get the correct information for you. But bonesmart.org is a really good site for information for people specifically going through hip and knee replacement surgery. And while their tips are only geared to those type of people getting that, the tips can also apply to everyone who is getting joint replacement in general. So those are good message boards. A lot of patients, they share their experience. And so you can read up on what people have done for themselves. And I did that and I found a lot of good tips for myself, where to get certain ice packs and physical therapy issues too, because a lot of people said that regular physical therapy was very aggressive for them. And I guess if there's one thing that I had to share about my journey and what I wish I was told is that I wish that, someone told me that there was another type of therapist out there that could help me because when you're living with a pre-existing condition, especially, rheumatoid arthritis or any other type of arthritis, everyone's body heals differently. So, you know, I had inflammation from the disease and then inflammation from surgery. So there was a lot of things working against me in terms of my healing. And when you're younger too, you build up a lot of scar, which is what I was told beforehand to watch out for. But no matter how much I worked out, it seemed that it was still going to get aggravated. So, listen to your doctors, listen to your physical therapist. If they feel that you should back off and rest, then do so because, your body's going to produce scar tissue regardless or not a lot of the times. And, we can't really prepare ourselves for how our body's going to heal. There's no way a doctor can tell you, hey, beforehand, you're going to experience this, this, and that, because there's no way to do that. And like I said, you can read the message boards, but don't overdo it. Don't get caught in the mind frame of being like absorbing everyone's negative experiences because then you're going to be worried about, is this going to happen to me? Am I going to get an infection? Am I going to have to do revision? Like you're going to have to, be more positive and say, okay, that person experienced that, but that doesn't necessarily mean that's going to be your story either, and what you experience. And yeah, so I ended up seeing a certified manual functional therapist, and that's what I wish I was told from the way beginning, because even though regular physical therapists are good, the certified manual functional therapist, and this is for anyone who has a more sensitive body and has a pre-existing condition where aggressive therapy may worsen what's going on, but the certified manual functional therapist and body gears is a good one. They have them in Illinois and California. However, there you can look online and see there's like a certain amount of people who are certified in this type of therapy, and they're regular therapists. They just are more gentle, and they a lot of people have received amazing benefits. People have avoided manipulations from going to see one, and just their range of motion has improved drastically. And also on the things that your doctor may give you as well, like this sort of continuous passive motion machine, also called CPM. A lot of surgeons don't give that out anymore, and a lot of patients found that there was no benefit from it. So research, do your research before you spend money or have insurance cover anything, because that all adds up to your, you know, medical cap in the end. So you need to be really careful, because you can also use that money towards your medical cap for more therapy as well. And yeah, I mean, the tips that I have. So, stay positive, be grateful for what you have. In the morning, also practice gratitude. It's really hard to get stuck in the mind frame. Like, I had surgery, and you get depressed and kind of, down on yourself that you can't really do what you wanted to do right away. You can't drive right away. You can't go out and you can't go around the block and walk with a friend or family member. You know, take some time to rest for yourself. So don't get stressed out that you're not seeing results right away, because the results will come. You just have to be patient and have a trusted family friend and loved one, keep you in check too. If you find yourself getting depressed and down, talk to someone you trust, and make sure that you're not, getting too hard on yourself. So in the morning when you wake up, just, write down 3 things you're grateful for. If you had a rough day at therapy, if you had a rough day during the day, and you're in pain, write the 3 things down that actually helped you out and were going well for you during the day. And you'll find that you'll have a more positive outlook and be more uplifted. So that's all I have today. And yeah, stay tuned for hopefully some more lives. And have a good day, everyone. Thanks. Bye.